recognized Dr. Miller-Meeks from Iowa for 5 minutes of questions.
Well, thank you, Mr. Chairman, and thank you, Governor Cuomo, for testifying before the Select Subcommittee today. I was hoping that we would see a Governor Cuomo that was less defensive and that was remorseful over what happened in New York, but I see that that person has not shown up today. The COVID-19 pandemic is long behind us. As a matter of fact, we were already behind it, through it, at the time this administration came into office. And an overwhelming majority of Americans have some form of immunity, whether from prior infection, which was denied by the current administration and CDC, both Dr. Fauci at NIH and Dr. Walensky as testifying before this committee. And we know more about the virus than ever before. That is undeniably true. But because of this Select Subcommittee, we've also had the opportunity to review policies, guidance, and practices from the pandemic to determine what worked and what didn't work. And let me also say, I'm one of the few members that was on this committee the last term, now my 4th year, as was Representative Raskin, my colleague on the other side of this dais, who could have easily asked you to testify when they were in the majority. However, you were never asked to testify during that 21-22 period. And they could have also asked a former president to testify. So let me just say that that could have been done. You know, as a nurse, a physician, a veteran, a former director of public health, I really understand that we need to have policies going forward that guide us for the next pandemic. And there were two aspects of the coronavirus that health officials understood very clearly from the beginning, from the Chinese Communist Party. One was how contagious it was, and two, how contagious it was among older people and people that had medical conditions that were at an increased risk of death from the infection. In February 2021, the Associated Press published an article outlining how in New York State, more than 9,000 elderly patients who still had active coronavirus infections were sent back to nursing homes after being discharged from the hospital. Despite this clear lack of medical oversight, that number was 40% higher than what the New York Health Department originally reported, and in the same report your administration published, the overall number of deaths in long-term care facilities was underreported by half, regardless of what excuses you present today to us. The state health commissioner tried shifting the blame by claiming most nursing home deaths were from asymptomatic staff who unknowingly transmitted infection. As a former state public health director, I find it completely appalling and disrespectful that you tried to constrict your own health department in covering up your harmful policies. You prohibited nursing homes from requiring testing. The CMS guidance allowed you and allowed nursing homes, allowed states to have a decision on who got admitted if they had proper allocation and proper separation in facilities. However, if you had an infection control program, as you said here today, now, that prohibited someone infectious from being admitted to a nursing home, why would you tie the hands of nursing homes by prohibiting testing? You said, how is COVID getting into nursing homes? How in the hell would you know if you prohibited testing? Testing was available. The CDC made mistakes in their testing. We understand that. But you prohibited nursing homes from testing individuals coming from hospitals who could have easily had COVID-19. Governor Cuomo, despite you clearly understanding the likelihood of COVID-19 running through nursing homes like fire through dry grass, as you said to Jared Kushner, your administration still required facilities to accept elderly residents who had active COVID-19 infections, and you prohibited testing. It really is shameful. But yet you want to continue to deflect the blame. So did you advise Governor Newsom of California or Governor Murphy of New Jersey or Governor Whitmer of Michigan on what they should do with nursing home admissions?
All Democrats. What a coincidence.
Well, I'm going to ask you, did you talk to Governor Reynolds?
I was on multiple calls with the Vice President and the Governors Association.
Thank goodness they didn't adopt your policies. CDC, did you talk to Governor Reynolds?
CDC and CMS allows the transfer of COVID-positive infectious people. And New York nursing homes do have the right
they did not
to deny anyone.
They did not. There was specific guidance. You did not follow the guidance. You did not allow your own public health officials to follow the guidance that was given to them. And in addition to which, we now know some states didn't adopt 6 feet distancing, nor did they adopt closing schools, i.e. Iowa did not, despite CMS's guidance, which could have been altered or adhered to by the directive of a particular state. So I find you complicit in what's occurred, and I find the fact that you don't take any, any remorse or any accountability and responsibility for what happened to be appalling. Thank you, and I yield back.
Congress